If you're diabetic, your eyes could be silently going blind, and you may not even realize it. Diabetic retinopathy can destroy your vision slowly without pain or clear warning. In this video, I'll reveal the top symptoms you must watch for before it's too late. Quick personal style message. Millions of diabetics lose their eyesight every year because they ignore these early symptoms. Tease what's coming. Stay till the end. The final symptom is often misdiagnosed. Section 1. What is diabetic retinopathy? Diabetic retinopathy is a serious eye condition that occurs when prolonged high blood sugar levels damage the blood vessels in the retina. The retina is the light-sensitive layer of tissue at the back of the eye that plays a critical role in vision. When these tiny blood vessels become weakened or blocked, they may begin to leak fluid or blood, causing the retina to swell and impair normal vision. Over time, this damage can lead to progressive vision loss and, if left untreated, may result in complete blindness. Diabetic retinopathy typically develops in stages, beginning with mild, non-proliferative changes where small areas of swelling occur in the retinal blood vessels. As the disease progresses, more vessels become blocked, and in the most advanced stage, known as proliferative diabetic retinopathy, abnormal new blood vessels begin to grow, which are fragile and prone to bleeding inside the eye. This condition often has no symptoms in its early stages, making it especially dangerous. By the time vision changes are noticeable, irreversible damage may have already occurred. That is why early detection through regular eye exams is critical for anyone living with diabetes. Let me now walk you through the most common symptoms you should never ignore. Section 2. Early symptoms in the initial stages. Diabetic retinopathy often develops without noticeable symptoms. This is what makes it so dangerous. The condition can silently progress while causing gradual damage to the retina. However, as the disease begins to affect vision, several early warning signs may appear. The first and most common symptom is blurry vision. This occurs when the damaged blood vessels leak fluid into the macula, the part of the retina responsible for sharp central vision. Patients may find it difficult to read, recognize faces, or focus on fine details. Another early indicator is the presence of floaters. These are small dark spots or shapes that seem to drift across the field of vision. They're caused by bleeding from tiny, weakened blood vessels in the retina. Some individuals may begin to experience dark or empty areas in their vision, often described as blind spots. These gaps in the visual field can make everyday tasks like reading or driving challenging. Poor night vision is also a common symptom. The ability to see clearly in dim lighting conditions becomes impaired, which may result in difficulty driving at night or moving safely in low-light environments. One of the most alarming early symptoms is sudden vision loss in one eye. This may happen if there is a significant hemorrhage inside the eye or if a retinal detachment occurs. Although less common, this is considered a medical emergency and requires immediate attention. It is important to understand that these symptoms may come and go. Some people may ignore them or attribute them to normal aging. But in a diabetic patient, even subtle vision changes should never be dismissed. Up next, let's discuss the more advanced symptoms that can indicate severe retinal damage. Section 3. Advanced symptoms. As diabetic retinopathy progresses into its more advanced stages, the damage to the retina becomes more severe and often irreversible. At this point, symptoms typically become more noticeable and more disruptive to daily life. These signs indicate that the disease has moved beyond early changes and now requires urgent medical attention to prevent permanent vision loss. One of the most prominent advanced symptoms is distorted vision. In this case, straight lines may appear wavy or bent. This visual distortion occurs when fluid builds up in the macula, the central part of the retina responsible for clear, focused vision, causing it to swell. This condition is known as diabetic macular edema and is a major cause of vision impairment in people with diabetes. Another advanced symptom is a significant change in color perception. Patients may begin to notice that colors appear faded, dull, or yellowish. This happens because the retinal cells that process color begin to degenerate as oxygen and nutrients fail to reach them adequately due to poor circulation. A very serious and alarming sign is vitreous hemorrhage, which occurs when abnormal blood vessels in the retina rupture and bleed into the vitreous, the clear gel that fills the center of the eye. This can cause a sudden appearance of large floaters, dark streaks, or even complete loss of vision. In some cases, the blood may be reabsorbed on its own over time, but in others, it may require surgical intervention. Dark shadows or a curtain-like effect over your vision can be an indication of a retinal detachment, which happens when scar tissue from abnormal blood vessel growth pulls the retina away from the back of the eye. This is a medical emergency and can lead to complete blindness if not treated immediately. In addition to these, some patients may experience eye pain or a feeling of pressure inside the eye. While pain is not a typical symptom in the earlier stages, it can arise in advanced stages, especially when retinopathy is accompanied by neovascular glaucoma, a condition where new, abnormal blood vessels grow in the iris and block fluid drainage from the eye, increasing internal pressure. At this stage, vision loss may be severe and irreversible if left untreated. Therefore, recognizing and responding to these advanced symptoms promptly is essential. If you or someone you know is diabetic and experiencing any of these signs, seek medical attention from an eye care professional as soon as possible. Section 4. Risk factors and who's most at risk. Diabetic retinopathy doesn't affect everyone with diabetes in the same way. While some individuals may go years without experiencing serious eye complications, others begin to show signs of retinal damage much earlier. Understanding the key risk factors is essential not only for prevention, but also for early detection and effective management. Let's break down the main factors that significantly increase your risk of developing diabetic retinopathy. Duration of diabetes. The single most important risk factor is how long you've had diabetes. The longer your body is exposed to high blood sugar levels, the more likely damage to the retinal blood vessels becomes. According to studies, almost everyone with type 1 diabetes will show some signs of retinopathy after 20 years. Similarly, over 60% of people with type 2 diabetes develop some form of retinopathy within the same time frame. Poor blood sugar control. Consistently high blood sugar levels accelerate damage to blood vessels throughout the body, especially in delicate areas like the retina. Hemoglobin A1C, which measures your average blood sugar over the past 2 to 3 months, plays a critical role here. The higher the A1C, the greater the risk. Keeping your blood glucose levels within a safe and stable range is perhaps the most powerful step you can take to protect your vision. High blood pressure. Hypertension adds a dangerous layer to diabetic complications. It puts additional strain on already weakened blood vessels in the retina, increasing the likelihood of leakage, swelling, and bleeding. In fact, patients with both diabetes and uncontrolled blood pressure face a significantly higher risk of developing sight-threatening forms of retinopathy. High cholesterol and lipid levels. Elevated LDL cholesterol and triglycerides can also worsen retinal damage. These fats can build up in the blood vessels and contribute to the formation of hard exudates, yellowish deposits that appear in the retina and indicate damage. Controlling lipid levels through diet, lifestyle, and medication can reduce this risk considerably. Pregnancy can temporarily worsen diabetic retinopathy, especially in women who already have some level of retinal damage prior to conception. Hormonal and metabolic changes during pregnancy can cause rapid shifts in blood sugar and blood flow, which may accelerate complications. Pregnant women with diabetes are strongly advised to undergo regular retinal exams throughout pregnancy. Kidney disease. Diabetes-related kidney damage, or diabetic nephropathy, is often associated with more severe forms of retinopathy. That's because both the eyes and kidneys rely on healthy blood vessels to function, and damage in one system often reflects damage in the other. Smoking is a major contributor to blood vessel damage and significantly increases the risk of diabetic retinopathy. It reduces oxygen delivery to tissues, promotes inflammation, and raises blood pressure, all of which are dangerous in a diabetic individual. Quitting smoking is one of the most effective ways to slow down the progression of retinal disease. Ethnicity and genetic factors. Some ethnic groups are at higher risk for diabetic complications, including retinopathy. For example, individuals of African American, Hispanic, and South Asian descent have been shown to develop more aggressive forms of diabetes-related eye disease. Family history may also play a role, meaning that if close relatives have had retinopathy, your own risk may be elevated. Who should be most concerned? If you've had diabetes for more than 10 years, if your A1C level is consistently above 7, if you struggle with high blood pressure or high cholesterol, If you're pregnant and have pre-existing diabetes, if you're a smoker or have diabetic kidney issues, if you fall into any of these categories, you are considered high risk. Regular eye exams, strict glucose control, and lifestyle modifications are absolutely essential for protecting your sight. In the next section, we'll talk about exactly what steps you should take if you experience any of the symptoms we discussed earlier, and how to prevent things from getting worse. Section 5. What to do if you have these symptoms if you or someone you care about begins to notice any of the symptoms we've discussed, whether it's blurry vision, floaters, color distortion, or sudden vision loss. It's critical not to wait. Diabetic retinopathy is a progressive condition, and every moment counts. The earlier you act, the better your chances of preserving your vision and avoiding permanent damage. So, what should you do if you notice these warning signs? Schedule a comprehensive dilated eye exam immediately. The first and most important step is to consult an eye care professional, preferably an ophthalmologist who specializes in diabetic eye disease. A standard vision check is not enough. You'll need a dilated eye exam, where the doctor uses special drops to widen your pupils and examine the inside of your eyes in detail. This allows them to see signs of swelling, bleeding, or abnormal blood vessel growth, even in areas you may not feel or notice yet. Share your complete medical history when you meet your eye specialist. Make sure to share your full diabetes history, including how long you've had diabetes, your recent blood sugar levels, whether you take insulin or other medications, if you've had any previous eye issues, any current medications for blood pressure or cholesterol. This information helps your doctor assess how aggressive your condition might be and what treatment options are most appropriate. Get regular monitoring and follow-ups even if your first eye exam doesn't reveal advanced damage. Don't assume everything is fine. Diabetic retinopathy can develop silently over months or years. Most experts recommend that diabetic patients, especially those with risk factors, undergo a comprehensive eye exam at least once a year. In cases where retinopathy is already present, exams may be needed every 3 to 6 months. Take immediate steps to control blood sugar once you experience symptoms. The time for passive control is over. You need strict, consistent blood sugar management. This means monitoring your blood glucose daily, staying within your target range, reducing sugary and high-carb foods, following your diabetes care plan, consistently taking insulin or oral medications exactly as prescribed. Improving your blood sugar control won't reverse existing damage, but it can slow down or even halt the progression of retinopathy in many cases. Manage blood pressure and cholesterol. Controlling high blood pressure and cholesterol levels is equally important. Your doctor may recommend antihypertensive medications, statins, or lipid-lowering drugs. A heart-healthy, low-sodium diet, regular cardiovascular checkups. Every percentage drop in blood pressure and LDL cholesterol significantly reduces stress on the retina. Follow recommended treatments without delay. If your eye doctor detects moderate or advanced retinopathy, they may recommend medical or surgical interventions, including anti-VEGF injections to stop new blood vessels from growing, laser photocoagulation to seal leaking vessels and prevent further bleeding, vitrectomy surgery to remove blood from the eye and repair retinal damage. These treatments are often very effective, but only when done early. Delaying treatment can result in irreversible vision loss. Adopt a diabetic-friendly lifestyle. Now is the time to make long-term changes. Quit smoking completely. Get at least 30 minutes of physical activity daily. Eat more fiber, vegetables, lean protein, and healthy fats. Get enough sleep and reduce stress. These lifestyle adjustments help not just your eyes, but your overall health and diabetes management. Don't panic. Take action. While the idea of vision loss can be frightening, the good news is that diabetic retinopathy is preventable and treatable in most cases, especially if caught early. Thousands of people live full lives with diabetes while keeping their vision intact. The key is to act fast and stay consistent with your care plan. In the next section, we'll explore the best modern treatment options available today, from medications to laser therapy, and how they work to preserve and restore your sight. Call to action. If you found this helpful, hit the like button and subscribe for more diabetes health tips every week. Comment vision below if you or someone you love has experienced any of these symptoms.